Hello, and welcome to this online lecture on Cricotiroidotomy to help prepare you for your training in the EMPT Cadaver Lab. My name is Dr. J Floccare. I'm an emergency medicine physician at the University of Maryland Medical Center in Baltimore, Maryland, and I'm the medical director for the 7 medevac helicopter bases that are operated by the Maryland State Police. Our objectives for this talk are 2. One is to make you comfortable that Crico is a relatively simple procedure, and 2, that you will be successful in performing a Crico should you find yourself in the high stress situation of a patient who needs one. Let's talk about the indications for doing a Crico. The main indication is that you are unable to ventilate a patient by any other means. This means going through all the types of things you would normally do, but without success. Now, sometimes the problem can also be massive bleeding in the airway that you're not able to control and therefore not able to effectively ventilate the patient. As an example, let's take this patient, a man who is smoking with oxygen on, and let's say perhaps he is sitting in a chair and he falls asleep, and now he starts a fire and he has burns in his airway that are progressively causing swelling of that airway, and the airway is in danger of swelling shut. Other examples of things that can cause a patient to need a Crico are an anaphylactic reaction or having a direct bee sting in the throat. For example, somebody drinking from a can of Coca-Cola and there is a bee inside the can, or a foreign body obstruction of the airway, or a patient with severe facial and mandible fractures that's not able to be effectively ventilated with a bag valve mask, or a patient with direct trauma to the larynx. So the first thing to do in this situation is to stay calm. Second is to not forget to perform good basic life support care. Oftentimes, the simple things of basic life support care can prevent you from needing to do a Crico. First, place an oral or a nasal airway to help your ability to ventilate the patient. Second, don't forget to do 2-person bagging with 1 person using 2 hands to make the seal of the mask. Third, if the problem is possibly due to the patient having choked on something and there being a blockage in the airway, don't forget to do chest thrusts in an attempt to try to clear that blockage. It's very important that you have a strong plan for managing the airway. And in most situations, for an advanced life support provider, that plan should first be good basic life support care. Second, moving on to endotracheal intubation if needed, both by direct laryngoscopy and possibly with video laryngoscopy if it is available to you. Third, a bougie or a frova can be an important assistance to you in performing the endotracheal intubation. And fourth, if you're not able to perform endotracheal intubation, having an alternative type of airway, such as an LMA or an iGel, a King, a combi tube, an AirQ, one of these other types of alternative airways. If none of these things work, then the fifth step would be to perform a Crico. This is an example of a patient that we had a few months ago that was trapped in a car and could not be removed from the car. And there was a bad fire in the car. And the patient ended up with these extensive airway burns. You can see the soot in the secretions here. And as you visualize the epiglottis, you see the epiglottis is very swollen. And in fact, an endotracheal tube was not able to be placed past this patient's vocal cords. So if you have a patient like this, what do you do now? Well, first, it's important that you stay calm and do not behave like these guys. That won't help. To do the procedure of a Crico, the only equipment that is necessary is a scalpel and an endotracheal tube. And if you also have a bougie or a frova, this can also be of assistance. The two keys to being successful in performing a Crico is first, know where to make your cut. And second, to when you're making the cut, hold the trachea still to keep it from moving side to side. The Crico is performed by placing the tube through the cricothyroid membrane, the membrane that stretches between the cricoid cartilage and the thyroid cartilage. In order to find the cricothyroid membrane, you first put your finger on the sternal notch at the top of the sternum. You slide your finger up to the first bump that you feel, the cricoid cartilage. And then you roll your finger up onto the cricothyroid membrane. And this membrane should feel almost like a little miniature trampoline, a soft spot where you are placing your finger. And in order to find this, I'll show you what I just described. You take your finger to the top of the sternal notch, you slide it up until you feel the first bump. There's the first bump, and then you feel a soft area that your fingertip goes into. And that is the cricothyroid membrane. And here we're back to our screen. Now, at this point, expect that your hands will be shaking, that you'll be a little bit nervous, and expect there to be bleeding when you make your cut. That is not unusual, and you just continue on in doing the procedure. You keep calm, and you cut until you reach the air inside the trachea. So the first thing is to stabilize the trachea between your thumb and middle finger. Stretch the skin between your thumb and finger, and then make a longitudinal cut. Again, stabilize the trachea between your thumb and middle finger, stretch the skin, and make your cut about 3 to 4 centimeters over top of where it feels to you like the cricothyroid membrane. Once you've made your cut, put your finger inside the incision and feel to confirm that that is the cricothyroid membrane. Now, you will see how easy this is when you are in the cadaver lab, but if you are uncertain of the location of the membrane initially, for example, if the patient is obese and has a lot of adipose, a lot of fat tissue in the neck, once you make your cut, it is much easier to feel the location of the membrane. Once you confirm that that's the location, then you make a transverse stab incision into the membrane. And again, we will do this in the lab, and you will be very comfortable in doing this. Once you've made your cut, then put the handle of the scalpel into the cut and turn the scalpel 90 degrees. And this is to dilate the hole, to make sure that the hole is large enough in order to place a number 6 endotracheal tube, a 6.0 millimeter endotracheal tube. And put the tip of the tube into the hole using the curve to point towards the feet. Now, at this point, if you have a bougie or a frova, you can first put the bougie into the hole and then slide the tube over top. As they're saying here, if you do have the bougie, if you do have the frova, that is something that can be helpful here, but it's not necessary. So to summarize the steps for a crico, first locate the membrane, make a longitudinal incision, confirm the membrane position by putting your finger inside your incision, then make a transverse cut across the cricothyroid membrane, dilate your hole with the handle of the scalpel, and then place your tube. You'll do this procedure when you come to the lab, and you will be comfortable with this. But afterwards, then it'll be important every few months to walk through these steps with your hands. You can have a tube and a scalpel and just pretend what you're doing, but just in your mind and your hands to walk through these steps. These are important just to keep you ready to do this at the time that it may be needed for one of your patients. Let's talk a little bit about doing a needle crico. So if you have a patient that is less than 8 years old, the needle crico is really your only option. For children that are less than 8 years old, the cricothyroid membrane is too small to place a tube through it. Now, if you have a patient that is 8 years old or older, it is normally better to do a surgical crico with placing the endotracheal tube rather than a needle, because when you place the endotracheal tube, it also allows the air to come out of the lungs much better than if you are ventilating with a needle crico. But in a child less than 8 years old, the needle is really your only choice. The other advantage of doing the crico with the endotracheal tube is that you are helping to protect from aspiration better than you would be with the use of a needle crico. You locate it in the same way. You are going through the same cricothyroid membrane. You again find the sternal notch. You slide up to the first bump. You roll your finger onto the cricothyroid membrane. You stabilize the trachea between your thumb and middle finger. You find where the membrane is. Again, feels like a small trampoline. And you can use either a regular type of intravenous catheter, or you can use a special curved type of needle made specially for doing needle crico. Ours happen to be made in Italy, the ones we carry on our helicopters. So you stabilize the trachea between your thumb and middle finger and insert the needle at a 90-degree angle to the skin, and then you draw back air from the syringe to confirm that your needle is inside the trachea. So again, you stabilize the trachea between your thumb and middle finger to keep it from moving side to side. And you put your needle in at 90 degrees to the skin. You confirm by withdrawing air into your syringe that you're in the trachea, and then you advance your catheter on towards the feet of the patient. Once your catheter is in place in the trachea, then there are different ways to ventilate through this. You can use a jet ventilation valve specifically for a needle crico, or there are other ways that you can attach oxygen tubing or a bag valve device to this. And we will show you some of these methods when we are in the cadaver lab. So in summary, whether you're doing a crico with an endotracheal tube or with a needle, it is a simple procedure. Remember to be successful that you should stay calm, that you just need to locate the cricothyroid membrane correctly and stabilize the trachea while you are making your cut or while you are placing the needle. And these things will help you to be successful in doing this procedure at the time that you need to. We look forward to seeing you in the lab and helping you to learn these skills.